members of Congress, congressional staff, public health leaders, and advocates to this briefing on the critical role of HPV vaccination in preventing cancer and reducing avoidable healthcare costs in the United States. My name is Martha Nolan, and I am the Senior Policy Advisor to HealthyWomen. HealthyWomen is the leading independent nonprofit health information source for women. For more than 35 years, we've been dedicated to educating women so they can make informed health decisions, advocate for themselves, and prioritize their health and wellness. We recognize that preventing cancer is a critical part of protecting women's long-term health, and human papillomavirus, known as HPV, vaccination plays a vital role in that effort. Infection from HPV, a very common virus that most people will encounter at some point in their lives, can cause, through certain strains, 6 HPV-associated cancers that affect men and women. From cervical, penile, vaginal, vulval, anal, to oropharyngeal, that's head, neck, and throat. Together, these cancers affect more than 40,000 Americans every year. Yet these HPV-associated cancers are preventable. Our briefing today, Preventing HPV-Associated Cancers, Saving Lives, and Reducing Healthcare Costs, is proudly presented by HealthyWomen's HPV Coalition, a collaboration of over 65 health and advocacy stakeholder organizations who have come together in an effort to increase the HPV vaccination uptake rate to prevent HPV-associated cancers and ensure essential screening and treatment. The HPV vaccine protects against the HPV strains responsible for the majority of these cancers and is one of the most effective cancer prevention tools available today. Public health authorities, including the Center for Disease Control and Prevention, recommend routine vaccination for adolescents, ideally before exposure to the virus. The HPV Coalition feels it is important that everyone is informed of this important cancer prevention tool. Further, increasing awareness and expanding access to HPV vaccination is especially important in rural communities where cancer prevention resources and healthcare services are often more limited. By prioritizing HPV vaccination, we have an opportunity to prevent cancer before it starts and reduce physical, emotional, and financial burden that cancer places on family and the healthcare system. Despite strong evidence of safety and effectiveness, HPV vaccination coverage in the United States falls short of what is needed to fully realize its cancer prevention potential. So increasing vaccination rates could prevent thousands of cancer cases and deaths in the incoming decades, while also reducing substantial costs associated with cancer treatment and long-term care. Preventing these cancers before they occur represents not only a public health opportunity, but also a fiscally responsible approach to healthcare. So today's briefing will highlight the scientific evidence behind the vaccine and current landscape of vaccination coverage in the United States, the importance of education and awareness, and policy opportunities that could help ensure more Americans benefit from this life-saving intervention. We will also discuss how improving access to HPV vaccination can advance health equity and reduce the burden of preventable cancers across rural communities. And after the presentations, we will have time for Q&A, so keep those thoughts in mind. So I'd now like to introduce our really esteemed panel of speakers. First, you will hear from Barbara Schuler, President and CEO of VAX to Stop Cancers, who will share her patient experience and resulting passion that has driven her to make HPV vaccination and cancer prevention a priority in Alabama and to bring Alabama's cancer rates from the top 10 to the lower tier. After Barbara, we will hear from Dr. James Campbell, Vice Chair of the Committee on Infectious Disease and for the American Academy of Pediatrics. He will help us understand the basics of HPV and the science behind HPV vaccine and the lessons learned over the last 2 decades of vaccination, strategies that the American Academy of Pediatrics are employing to increase vaccination rates, and the astronomical costs of not vaccinating our children against HPV. Then next you will hear from Dr. Sal Giorgianni, co-founder and president of HealthyMen, and from his fellow co-founder, Dr. Jean Bonhomme, who is also the founder and president of the National Black Men's Network. HealthyMen is working to close the gaps that exist in HPV vaccination in men and to increase awareness and education of the importance of vaccinating boys and men to prevent the spread of HPV and HPV-associated cancers. Finally, Krista Rommen, Director of Louisiana Families for Vaccines, will speak about the importance of HPV vaccination to public health and how they are reaching vulnerable communities to close gaps in access to vaccination. However, before we begin, I am honored to share welcoming remarks from Congressman Don Bonhomme from Nebraska and Congresswoman Kathy Castor from Florida, the leading co-sponsors of the PREVENT HPV Cancers Act, which was introduced in December. This bill will prevent cancer and save lives by raising awareness about HPV and HPV-associated cancers through a national education campaign for healthcare providers, parents, and the public on the life-saving HPV immunization. The bill also strengthens efforts to expand access to timely cervical cancer screening and diagnostic services for uninsured and underinsured individuals. We are thankful for their leadership on this issue and for joining us today.
I want to welcome everyone to this conference. I'm a big supporter of HPV prevention, and I'm on this bill to do the Prevention Act because so many people are negatively affected by cancer caused by HPV. So we want to support more education. We want to promote early screenings and more regular screenings. Also the vaccine, because in the end, we want to have people healthy and safe from this bad disease that affects so many. Thank you. I want to welcome everyone for the
Hi, I'm Congresswoman Kathy Castor of Florida. Thank you to HealthyWomen for bringing us together to discuss the prevention of HPV-associated cancers. To start, since 2006, we've had a safe, effective immunization that protects against 6 types of cancer, including cervical cancer, all caused by HPV. One of only 2 vaccines that can actually prevent cancer, yet far too many people remain unprotected. People are dying from these cancers when they shouldn't be. Around 39,000 Americans are diagnosed with HPV-associated cancers each year, and that's devastating for their families and communities. That's why increasing immunization rates and screening and early detection are critical. When HPV-associated cancers are caught early, they are far more treatable. Unfortunately, screening rates have declined in recent years, leading to more late-stage diagnoses, cases that are harder to treat and are more likely to recur. And across the board, there are persistent disparities in who gets vaccinated, who gets screened, and who survives. That's why I'm proud to champion the bipartisan PREVENT HPV Cancers Act with my good friends, Representative Kim Schreier and Don Bacon. Our legislation would launch a national public awareness campaign on HPV-associated cancers to highlight the importance of the cancer prevention, HPV immunization, and the importance of screenings. Our bill also boosts funding for cervical cancer screening for our uninsured and underinsured neighbors. Only 63% of American adolescents are up to date with their HPV immunization. So we must do so much better. We have the tools to come together and reduce cancer incidence and deaths. So it's past time to work together to use them. And I encourage everyone to ask their members of Congress to co-sponsor the PREVENT HPV Cancers Act so that we can save lives. Thanks.
Thank you, Representatives Bacon and Representatives Castor, for joining us today and for your leadership in HPV and cancer prevention. Before we hear from our panel, I just want to remind you to put your questions in the Q&A box, as I will make sure there's time for questions at the end. I would like to turn the microphone over to Barbara Schuler. Barbara, the floor is yours.
Hello, everyone. My name is Barbara Schuler, and I am an HPV cancer survivor. In 2009, I was diagnosed with anal cancer. I'd never heard of anal cancer. I'd never heard of HPV. People didn't talk about this subject. People don't talk about this subject. When the vaccine came out for my boys, they were in college, and I didn't know anything about the vaccine, and I didn't hear from the doctor. I was misdiagnosed in the beginning. I was bleeding, and my doctor diagnosed me over the phone with hemorrhoids and sent me medication. A few weeks later, I called back a second time and told him I was bleeding again. He told me to come to the office right away. Many anal cancer patients are misdiagnosed. My treatment included 25 rounds of radiation and 2 rounds of chemotherapy that went home with me and was continuously being pumped into my veins both day and night for 4 days at a time. I was getting chemotherapy while I was also receiving radiation. It was so unbelievably painful to sit down and to use the bathroom. The pain patch did help a little. The chemo made my tongue swell, which made it difficult to eat, and there were sores in my mouth. The second round, the doctor cut the dose in half because the reaction was so severe. There isn't a day that goes by that I don't have some kind of symptom or sensation that reminds me of my cancer. For 10 years, there was a lasting fear that the cancer would come back, and I'm very blessed that it has not. But I do wish that I could have had the opportunity to get the HPV vaccine to prevent my cancer. The vaccine prevents over 90% of the 6 cancers. Because there is so much stigma associated with these cancers, I first told people I had colon cancer. Then I said I had rectal cancer. And finally, I called it what it was. But who in the world wants to tell somebody when you've never heard of anal cancer to say, I have it? No one talks about these cancers. It's a hush-hush subject. Parents don't believe their children will have any kind of intimate skin-to-skin contact before they are married. And that's all it takes is intimate skin-to-skin contact to get an HPV infection. Regardless, 91% of men and 85% of women will have HPV at some time in their life. HPV is a public health epidemic. This virus is as common as the common cold, but without symptoms. Of the 6 cancers, cervical cancer is the only one that there's a test for HPV. No one used to talk about breast cancer, and now it's openly discussed. This same thing needs to happen with HPV cancers. We must stop the stigma and talk about these diseases. If we said there was a vaccine to prevent breast or prostate cancer, parents would line their kids up around the block to get the vaccine. The HPV vaccine is underutilized, and its uptake is much lower than that of the other 2 vaccines given to adolescents, the Tdap and the meningococcal vaccine. The vaccine is not required for school in most states, and parents don't think their children need this vaccine. There is also much information on social media about the HPV vaccine that is incorrect. There must be more education and awareness about this vaccine. We already have a cancer vaccine for HPV. Because I survived my cancer, I wanted to do something to give back. With my master's in public health and my interest in prevention, I started VACS to Stop Cancer, a nonprofit that is raising HPV vaccination rates in Alabama. As you can see on the screen, our mission is to prevent cancer by expanding the use of the human papillomavirus vaccine through education, public awareness, and advocacy. And we are committed to increasing HPV vaccination completion rates by 10% in Alabama males and females ages 9 to 13. We have 3 programs, as you can see on the next slide. Our first one, and this is our flagship program, is our HPV provider education program. We train pediatric and family practice providers. We teach them the most effective method for recommending the vaccine at age 9, starting at age 9. We teach them research-tested messaging to counsel hesitant parents. And we use strategies to decrease missed opportunities to give the vaccine. Our dental provider education program is an online, on-demand program that trains dentists, pediatric dentists, and hygienists on recommending the HPV vaccine to their 9 to 26-year-old patients. They're a wonderful provider to be recommending this vaccine because they see their kids, their patients twice a year. And oropharyngeal cancer is now the most frequently diagnosed HPV cancer, surpassing cervical cancer diagnoses. Next is, this is our newest program, is an OBGYN and family medicine program, which we train in rural areas to reinforce the role of the providers in protecting their patients against cervical cancer. We teach them systems for documenting patient HPV vaccination status. We give them resources for HPV vaccination referral and teach them skills for talking to patients about HPV and the cancers. And we want to make sure that they are utilizing the HPV test along with the Pap smear test. And then we give them an app from the American Society of Colposcopy and Cervical Pathology on the best practices for managing screening for and follow-up for HPV. And I don't know, is there a way to pull the screen up just a little? You can't see the very end of it. But anyway, our website is vax2stopcancer.org. Please check us out. And now I want to introduce you, turn the mic over to Dr. Campbell. And thank you.
Thanks, Barbara, and thanks everyone for joining. Thanks for having me. My name is Jim Campbell, and I'm a pediatrician and a pediatric infectious disease professor at the University of Maryland School of Medicine in Baltimore. And I'm also, as you see there, the vice chair of the Committee on Infectious Diseases. So we're the ones for pediatrics who write vaccine schedules and make all the policies for pediatric practice that have to do with infections. Next slide. Next slide. So these are my objectives in the next 10 minutes, really, is to go over some of the basics about what human papillomavirus is. So, and as it says here, these are the spoilers. So what is HPV? You've already heard, this is a virus and it causes cancer. What does the vaccine prevent? It prevents those cancers. It also can prevent some other things that haven't been brought up yet, including these really horrible airway growths that can occur in children called papillomatosis, and warts as well, genital warts. We've had HPV vaccines now available in the United States for 20 years. We're at the 20th anniversary now. What's happened in those 20 years? Very large reductions in HPV infections and in precancerous lesions. And now we're also seeing reductions in cancers and in cancer-related mortality. What does HPV have to do with pediatricians? Well, we're the ones who typically give the vaccine because it's recommended to be started at age 9. These vaccines have some of the longest life in terms of protection of all vaccines that we have. So we haven't found any reduction in protection over the many years after we give it to these young children. And what about cost and HPV vaccines? Vaccinating young people is very cost effective because not vaccinating, the cost of the screening and diseases is very high. Next slide. Next. So papillomaviruses, all viruses are split up into either those that have DNA inside or RNA inside. These happen to be DNA inside, and they're all different types. So even though they're all HPV, we number them into about 200 different HPV types. About 12 of them are what we call oncogenic, or also known as high risk. That means onco, cancergenic, causing. So they cause cancer. All of the others do not cause cancer. They cause other diseases. 13 million persons in the United States become infected with a disease-causing HPV type each year. Many of them, you get infected and then the infection goes away, but it's the persistent infection with HPV, and we can't predict who will, when you get HPV, who will go on to have persistent infection versus transient infection. And that little picture on the right there, you can see the different cancers. So Kind of the teal color are the ones that are only in women, cervical, vaginal, and vulvar cancers. The blue is the ones only in men, that's penile. And then the yellow, both men and women, oropharyngeal and anal cancers. Next. So as I said, there are lots of different types of HPV, and the ones on the right side here say cutaneous sites of infection. So that means like the dry surfaces on your skin, your feet, etc. So any of you have ever had warts or had children with warts or plantar warts on your feet, those are caused by a type of HPV infection, but not by the type that the vaccine covers. The vaccine is directed against those that we call mucosal affecting HPV. Mucosal means the wet surfaces, like mouth, throat, cervix, vagina, etc. So some of them, as I said, cause cancer, and some of them cause warts and papillomatosis. Next. Nearly every human gets infected with HPV in their lifetime. More than 90% of us either have been or will be infected with at least one type of HPV, so it's ubiquitous. About 79 million Americans are currently infected. That number is falling because of HPV vaccination. 14 million new infections every year, also falling because of vaccination. And it's most common in people in their late teens and early 20s. And most people never know that they were infected. As I said, 90%, and most of you listening have been infected, but maybe never know that you have that infection. Next. This is what the cancers look like for males and females. In the darker blue are those that are caused by HPV 16 and 18, the most common cancer-causing HPVs. And in the lighter blue are the other 5 that are in the vaccine that we have now. So we have 7 different types of HPV in the currently available vaccine that protect against cancers. 2 in the dark blue and 5 in the light blue. So you can see almost all cervical cancers are covered by the vaccine. Most vaginal, vulvar, anal, oropharyngeal, penile, all of them covered. And you can see the ones that cause the biggest burden are cervical cancer way up at the top there and oropharyngeal cancer at the bottom. Preventable per year, approximately 31,000 cancers. That's 85 cancers a day by having an HPV vaccination program. People take advantage of this cancer preventing vaccine. Next. HPV infects everyone. It's men and women. It's white, black, AIAN, Asian Pacific Islanders. It's Hispanic and non-Hispanic. Everyone gets infected. There's some differences by race, by sex, by ethnicity, but overall it's high rates for everyone. Next. The vaccine that we have is what we call a virus-like particle. So there's a picture of it there on the right. This is like taking the shell of the virus and removing from the inside all the DNA, so all the part that allows it to be infectious or cause cancer, and only having the shell. And that shell leads to a very strong immune response. Your immune response to the vaccine, to these VLP, virus-like particles, is much higher than the immune response that you have to natural infection. And that's one of the reasons that we get such good protection against HPV by getting vaccinated. Next. In the past, we had what we call a bivalent vaccine that only went against 16 and 18, the 2 most common cancer-causing HPV types, and a quadrivalent, Gardasil 4 that was called, or Gardasil, that had 6 and 11 that caused warts and the 2 most common cancers, 16 and 18. But now the one that we use in the United States has 9 different types in it. 7 of them are oncogenic or high-risk types, and 2 of them are wart types. So you can see there what the 9 types are and what they cover. Next. What are our recommendations? We recommend that all children starting at age 9, but certainly by the time that they're 13 or 14, that they receive 2 doses of vaccine. They're given at time 0, the first time that you give it, and then 6 to 12 months later. And as long as you start the series before the 15th birthday, then it's only 2 doses. If the series is started after the 15th birthday, or if the person has problems associated with their immune system where they may not react as well as someone with normal immune competence, then it's 3 doses at 0, then 1 to 2 months, and then 6 months. And everyone through the age of 26 should be vaccinated. And then above age 26 up to 45, there's also the option for those folks to get vaccinated as well. It only works, the vaccine, for HPV types that you've never been exposed to. So that's the primary reason why we give it to young people, is they make a better immune response than older people. They've not been exposed, almost none of them have been exposed to HPV so far. And the protection lasts a very long time, for decades. So that is those three reasons are why we give it to young people. Next. Cost. Annual direct costs in the United States without vaccination are $9 billion for HPV-related care. A single birth cohort just of girls, meaning like over 1 year, all people that were born in that year, if you take them for the lifetime costs for a birth cohort of girls, it's about $25 billion for the screening and care for HPV-related disease. If we vaccinate on the current schedule, $3 billion saved per vaccinated cohort over their lifetime. So right now, the vaccine is highly cost effective compared to other vaccines and other health interventions that we have. And what do we mean when we say cost effective? We mean that it provides a large health benefit at good value. Over time now, because we're reducing the risk for example, cervical cancer, we're able to start changing the screening recommendations for those who are at lower and lower risk, who have been vaccinated and are HPV infection negative. As the screening intensity goes down over time, we're not only going to have a cost-effective vaccine, it's predicted that we will have cost savings, meaning it's cheaper overall for society to have the vaccination program than to not have the vaccination program. We save money. Next. So real world effectiveness, what that means is after a vaccine is introduced and recommended, then looking at what actually is happening with prevention of infection, prevention of precancers, and prevention of cancers themselves. So this shows you up to 2022 what was seen, and you can see it's just phenomenal reductions in HPV infection. So the people who have the most reduction are those who have had the opportunity to get protection by vaccination. So if you look at 14 to 19-year-olds on the left-hand side there, pre-vaccination in the dark blue, it was 11.5% who were infected. Now we're down to 1.1%. So about almost 90% protection against all of the HPV types, these four types that were in the original vaccine. 81% lower in the 20 to 24-year-olds. We haven't yet been able to see a lot of reduction in 25 and up and 30 and up because they didn't have the opportunity to get vaccinated when they were younger. But over time, as people age, get older and older, as I said, we're only 20 years into vaccinating, we're going to see those same reductions in older folks. Next. This is a horrible disease that pediatricians and pediatric surgeons have to take care of. The risk, the overall burden is not that high, but it's just a terrible disease. This is where babies get asymptomatically infected at the time of birth in their throats. And then over time, these growths grow. There's a picture there on the right, these warty, wet growths inside their trachea, and it makes it very difficult for them to breathe. The only way to treat it is by recurrent surgeries. And you can see there in the graph just how much reduction we've already had in this problem called recurrent respiratory papillomatosis in babies. 75% reduction in the 7 years after vaccine was introduced. And if we can completely get rid of this, it will save a lot of morbidity and some mortality. Next. So what have we seen with reductions in cervical cancer? The average age for women to have cervical cancer is about 47 in the United States. So it takes some time. There's a delay between the time when you're giving vaccine to 9 to 13-year-olds before you're going to see the major reduction in cervical cancer. But some women get it younger, in their 20s and 30s. And you can see here in the orange, just 8 years after the introduction, in 15 to 24-year-olds, a 29% reduction in cervical cancer, and in 25 to 34-year-olds, a 13% reduction. And in the bottom bullet there, you see those vaccinated in 2006 and 2010, when we first started vaccinating 20 years ago, they were age 11 to 12. They're now hitting their 30s. So they're starting to get into the age range where cervical cancer is more and more common. So we're going to be able to see more and more of a benefit. Next. There was some reduction in HPV cancers even before we had the vaccine because of increasing screening rates, being able to capture early precancerous lesions and prevent them from going on to cancer. But if you look at this graph, you can see that there was a quote join point in 2008, 2 years after we started the vaccination program. Before that, we were seeing about a 2% reduction in annual cervical cancer rates. And after that point, a 7% reduction every year. Next. This shows you cervical cancer mortality rates, both what we would expect by a projection and then what we're observing. And you can see the observation is a dip beyond what was expected before, and cervical cancer deaths going down and down every year. Other studies besides these two graphs have shown 12% per year decline and overall 65% reduction in cervical cancer incidence from 2012 to 2019 among women younger than 25 years. Next. This was a study done in Scotland, and I circled an important data point there. In Scotland, if vaccinated by the age of 12 to 13 years, 0 cases of cervical cancer after 140,000 person years of follow-up. So if we can get people vaccinated before they're 13, we can expect that they're going to go on to have very low rates of cervical cancer. Next. And this was recently published about a year ago now in MMWR, the CDC publication, looking at cervical precancers in women in the United States from 2008 to 2022. And if you look at that dark line that kind of crosses all the other lines, the line itself was the modeled expectation of what would happen in 20 to 24-year-olds in these years, given the vaccination, having the availability of HPV vaccinations. The the blue open squares is the observed reduction, and it's right on top of the modeled reduction. 79% reduction in CIN2+, which is cervical precancer, early cervical precancer, and 80% reduction in CIN3, which is more advanced precancerous. So just an amazing reduction in cervical cancer and precancers. Next. So this is my last slide. The key points that I want to get across: HPV vaccines are highly effective in preventing persistent HPV infections. And because of that, then preventing precancers. And then, of course, if you're preventing precancers, you're preventing cancer as well. HPV vaccines are cost effective, and if screening intensity reduces over time, which it already has, and it will even more in the future, is going to lead to cost savings. HPV vaccines have led to large real-world reductions in HPV infections, in precancers, in cancers, and in recurrent papillomatosis in children. And with increased proportions of preteens and teens being vaccinated, we can expect very large increases in HPV-associated cancers over the next few decades. But as people, you may have heard this saying before, but it's not vaccines that prevent cancers and prevent infections, it's vaccinations. So without actually getting the vaccine into people's arms, having them on the shelf doesn't help. So this bill to get education out and for more people to get vaccinated is really important. So thank you very much for allowing me to give you this presentation. And I'd like to turn the microphone over now to Dr. Sal Giorgianni.
Thank you so much. Thank you all for attending this very important session. I'm co-founder and vice president of HealthyWomen, Inc. I'm also co-chair emeritus of the American Public Health Association section on men's health. Next slide. Well, here we go. Just repeat. We have some disclosures here. As is always the case, nothing to disclose, not professional or financial conflicts that I feel would impede my ability to give you unbiased information. On the next slide, I have the obligatory data side, although we have seen an awful lot of data already. A couple of things I'd like to point out here, as has been stated, that there is a very important distribution, almost 50,000 cases of HPV-related cancers, almost evenly split between men and women. We often think about it as a condition that affects women primarily, but we do have a significant burden of disease for men as well. And when we look at the numbers of individuals, I think it's been mentioned by folks before, but just to highlight it, that for overall childhood vaccinations, HPV vaccines lag behind the average rate. And we still don't see, and when we talk about up-to-date vaccines, remember the current guidelines prior to 2026 were the 2-vaccine protocol for younger individuals. So the data I'm presenting is based on that protocol. We only see about 61% of the total population, men and women, are up to date. The other point I'd like to make here is while the clinical presentation of the infection often occurs a few months, a couple of years after infection, you can see it decades after infection. And we will talk a little bit about that in the next series of slides, which looks at a composite case. But I did want to have you think for a moment about what it means to be going about your average daily life, post-college, post-military service, post your wild and crazy days on the club circuit, and then in your 40s and 50s, be diagnosed with a severe sexually transmitted disease. Just think about what that might mean. So let's take a look a little bit about, because data is important, but I think the patient, we want to keep focus on the patient. Healthy Men is always looking to make healthcare more guy-friendly, and I think portraying on the next series of slides, next slide, please, our composite patient on the next slide is Bill and his family. For the most part, conditions don't just affect an individual, they affect their family, they affect their community. So here we have Bill, who's married 22 years, stable job, volunteers in the community, 2 great kids, very active in all sorts of activities in the community, 45-year-old husband, and he sought care at the VA clinic. It could be at the regular clinic or his primary care doctor, if he had a primary care doctor. Unfortunately, many men don't. The symptoms have been progressing. He's found painful sore in his tongue and cheek, and it's been progressing over several months, making eating and daily habits difficulty and leading to some pretty obvious deformities in his mouth and lips. After a medical evaluation, it was confirmed he had HPV-related cancer of the mouth and throat. And looking at his history and in composite patient Bill's case, it was probably seen have developed in his early 20s during overseas military deployment. It could be during college, it could be just everyday life. And the big point here to leave you with, his parent, who took him in for his regular visits, was offered HPV vaccine when he was 11 years old, a great time to get it. But because that parent couldn't deal with the notion of their ideal son being sexually active 9, 10, 12 years later, they declined the vaccine. That's a large part of it. People don't want to really think about that. So let's go on in the history with Bill in the next slide. Here's a picture of what we saw a few months into the clinical course for Bill. I spared you the impact of this type of a pathology occurring in the other target tissues that were mentioned, but it is a disfiguring and it is a very difficult sort of pathology to wrestle with. On the next slide, we'll talk a little bit about the treatment of course, and our good colleague earlier today gave her personal journey, and that is a personal journey that I've seen with everybody who proceeds with clinically significant HPV-related cancers, surgery to move the tumor, affect the lymph nodes, several weeks of targeted radiation, chemotherapy with radiation in higher disease risk patients is very common. Imagine what that feels like on these sensitive target tissues. Reconstructive oral and facial surgery was something that Bill had to undertake because he waited too long to get adequate treatment. Rehabilitation, nutritional rehabilitation. You can imagine not only the effects of the chemotherapy and the radiation, but also the absolute almost impossibility of eating food or even taking things in parenterally with a feeding tube. The psychological care for Bill and his family. Imagine his 12-year-old son, his 18-year-old daughter, his 40-plus-year-old wife, and how this just traumatized and stigmatized them in their communities. And then there's, of course, follow-up care. Estimated cost, when you think of the personal cost, the estimated cost, I think the dollars are almost laughable, but they are real costs, and this is based on a VA estimate, which to my humble opinion seems a little bit low. $130,000 over the first 2 years and follow-up costs of about 40. It could be significantly higher with people with more significant pathology. So on the next slide, we'll talk a little bit about the cost to his family. Next slide, please. Put yourself in a scenario, if you possibly can even imagine it. Significant amount of emotional strain for his wife, for his children, required marriage counseling, significant stigma and shame at work for all the organizations that Bill had volunteered within the community, for his kids, because people were becoming more knowledgeable. Terrible physical problems. The spouse who had worked a job, absolutely necessary in this economy, became a primary caregiver to him, as well as an emotional caregiver to Bill during the course of treatment and after. And then the emotional financial stress, which didn't just impact the here and now today, but also carry through their entire time and probably into their retirement years, this huge financial and physical impact. On the next slide. 5 little takeaway points here, relevant to men in particular. Unfortunately, as we see in so many cases for preventive care, men are often overlooked in the primary care education, particularly with something such as childhood vaccinations, including HPV vaccination. The educational gap that this bill is looking to breach, to correct, weakens overall vaccination efforts. Fathers must be actively included in education and formal decision making, from the pediatrician, from GYNs. So, dads are an important resource. They can be, we understand at Healthy Men Inc., they can be a very wonderful facilitator, or they can be someone who stands in the way or leads skepticism for vaccination. Dads must become knowledgeable about the importance of this for their 11-year-old who soon will become sexually active. Resources and funding for education of men needs to be an important and integral part of any activities, including the legislation that we are talking about in this session. Next slide, please. Educating men and families is essential. It helps bring down the rates of cancers. It helps increase the rate of vaccination, and it's also the right thing to do. Next slide, please. We urge your support for this act, and not just for the act, but also for state and local efforts in your communities, your and your representatives and legislator support. It's very important. And in the next slide, a final thought. As every grandfather knows, you just can't weed half the garden if you want to get good results. You have to take care of both the exposure to men and women. Next slide, please. One of my very, very good colleagues, the founder and president of the National Black Men's Health Network and co-founder of Healthy Men Inc., Dr. Bonhomme, who's also a certified men's health educator, couldn't be here today because of scheduling conflict. However, he strongly supports the goal of HR 6561 to provide clear, accurate information about HPV vaccination. And Dr. Bonhomme has asked me to provide you with some brief remarks on behalf of the National Black Men's Health Network. The National Black Men's Health Network is a nonprofit organization established in 1987 to raise awareness and advocate for improved health outcomes for Black men and boys in America. Men's health has a direct impact on the health of women, children, and the entire community. This is especially true when it comes to prevention of sexually transmitted infections, including HPV-related cancers. These infections are highly communicable, yet HPV is one of the few for which we have a highly effective vaccine, one that prevents infection and reduces the medical, personal, and financial burdens of cancer for both men and women in our communities. Although African Americans represent approximately 12% of the U.S. population, our communities continue to experience a disproportionate burden of sexually transmitted infections, including HPV, HIV, chlamydia, gonorrhea, and syphilis. While vaccines do not yet exist for most of these conditions, we do have a proven and effective vaccine against HPV, and we must increase the uptake of this vaccine. The single most important step to increasing HPV vaccination rates is providing clear, culturally relevant, and well-developed information that emphasizes the importance of early vaccination. We urge passage of H.R. 6561, and the National Black Men's Health Network, along with Healthy Men Inc., stands ready to assist in crafting and distributing messages to communicating the importance of these vaccines to the communities we serve. Thanks very much for the time. And now I'd like to offer the podium, or the virtual podium, to Crystal Rommen to talk about her perspectives.
Thank you all for coming today. My name is Crystal Rommen. I'm the Director of Louisiana Families for Vaccines, and I wanted to highlight some of the community events that my organization has put on around HPV awareness. Next slide. We do a lot of community outreach and education for all vaccines, but HPV is near and dear to my heart. We are a grassroots network of Louisianans dedicated to advocating for public health and fact-based public policy and promoting immunizations for healthier kids and communities. Next slide. I like what he said, the physician before me said, you know, vaccines don't necessarily work unless they are in shots and arms. So it's vaccination that is so important. And so I think my endeavors have centered around trying to elevate the information in a way that our community can receive culturally relevant, culturally competent ways. So back in 2025, we did an event through the National Day of Racial Healing. We hosted a film screening and panelist discussion around the story of Henrietta Lacks, who died of cervical cancer, but ultimately her life was used to promote a lot of medical advances. And so this discussion really centered HPV awareness around the intersection of health equity, race relations, and bioethics. Next slide. I want to introduce you to my friend Terry Love. She is Louisiana Families for Vaccines HPV Community Ambassador. As an HPV cancer survivor, she had the opportunity to partner with Survivor with a C, their Communities of Color Survivor Retreat down in New Orleans back in October, and that experience was wonderful for her. She got to meet other HPV cancer survivors and gain a lot of tools in her toolkit to come back to our region and put on an event with me. Next slide. So after she came back from New Orleans, the Teen and Parent HPV Awareness Summit was born. So we put on this event. We called it Knowledge is Your Light, Teen and Parent HPV Awareness Summit. And this was designed to provide a multifaceted and interdisciplinary approach to elevating information. I think data and statistics and experts are great. We want to come alongside the trusted information and trusted messengers in our community to elevate information in a way that people will be able to receive it. So our event centered around storytelling for HPV awareness. Next slide. I wanted to share some pictures from this event. I emceed the event at my church. This middle picture here is Portia. She's an HPV advocate, and she did a dramatic arts presentation, a monologue around Henrietta Lacks's life. And the goal was to share the story of Henrietta Lacks, but then also encourage people to use knowledge to pass on her light and her life and her legacy to the next generation. This third picture here are our HPV survivors who were able to tell their stories as well. Next slide. I used some medical students who are very eager to volunteer for this event to do some vaccine education. We had 3 different educational components. We had a history of vaccine development in general. So Francesca gave a presentation called Vaccination History is Part of Your Story. Then we had Ilsa talk about common vaccine myths that we called untrue stories about vaccines. And then finally, Maggie talked about the current science around HPV infection prevention treatment, called Writing the Final Chapter on HPV. We were so honored to have some physician panelists join us as well, both virtually and in person, so that the community had an opportunity to respond to the information, ask questions, and engage in dialogue around HPV awareness. Next slide. On the left here, we have Jamie Mays. She is an educator and consultant, and so her keynote address presented information and how HPV awareness is important for health literacy, and how telling your story is a very important part of that health literacy. And then, of course, no community event would be complete without a great balloon arch and a fantastic lunch spread. So we had a lot of aspects that made this event very successful. Next slide. So in particular, I want to talk about our collaboration with community partners like medical students, youth mentorship programs in the community, local physicians and HPV survivors, an HPV advocate, or this could be an artistic person in your community, our local church, and then our educators as well. I offered social work continuing education hours, and we had a successful media presence through social media, radio, press, local news. And then I invited community partners beyond the scope of HPV to table at the event and offer some community resources and wellness resources at the event. Also, this was both in person and hybrid, so that individuals who are not local to our region could still attend virtually. And so I captured some data after the event, and people really responded positively to numerous aspects of this event. And so some of the favorite components of it was the HPV survivor stories, the knowledge they gained from HPV, the physicians Q&A, the intersection of health literacy with the HPV awareness, and of course, free lunch. So beyond the scope of this presentation, Louisiana Families for Vaccines also helps people navigate information about vaccines, whether that is in the community with your family and friends, but also with our policy decision makers. And so every year we have a presence at the state capitol to help elevate accurate information as people are making policy decisions related to vaccine access. And so we invite you to join us if you're in our region to come to Baton Rouge on April 21st, stand on the steps of the Capitol with other vaccine advocates. And so the last thing that I will share, you can go to the next slide, is that all of this programming is possible because we have funding, we have support from our community partners, and so having an ongoing support through this bill, through this act, would have a significant impact on our ability to communicate accurate information in a compelling and culturally sensitive way. This is my son Toby, and he is 10 years old. He is now fully up to date on his HPV vaccine. So if you guys would like to connect with me, here is my information, and I thank you again for letting me join you today and share this information.
Thanks so much, Crystal, and to all of our panelists for your wonderful remarks. While we bring all our panels back up, and want to remind participants that you can put questions in the Q&A feature, but during this time, I'm going to play a video from a very special patient, Sean Donnelly of California, who grew up on a farm in Missouri and is a U.S. Navy submarine veteran who is losing his battle against HPV-related squamous cell carcinoma at the base of his tongue, and who has very much wants to give us an important message about why we need to take HPV seriously, get vaccinated, and to get screened. Please play his message.
Hi, my name is Sean Donnelly. I was diagnosed with squamous cell carcinoma in May of 2022. I had a lump in my neck on the lymph node from November of 2021, but I kind of ignored it and assumed it was a cause of some infection. As it turned out, it was squamous cell carcinoma, HPV related, that had metastasized from the base of my tongue into my lymph nodes, and it spread from there. Unfortunately, like most people my age who are in great shape and working a great job, I refused to believe that I could possibly have cancer. It wasn't until the lymph nodes swollen to a point that I couldn't ignore it that I went and got tested and determined that I was squamous cell carcinoma positive. Since that time, I've been fighting cancer with multiple rounds of radiation, chemotherapy, and many surgeries. Unfortunately, my battle is nearing its end as I've been diagnosed as terminal with maybe 3 to 6 months to live. I'm now in hospice care and fighting every day to stay alive and support my family. My message to you is don't ignore it. You may think it's not possible for you to have cancer, but it is. If you're of an age where that's even remotely possible, get tested. If something feels abnormal, get tested. Find out what it is, get it treated early. I have a few friends who have the exact same cancer I had, and because of early detection and early treatment, they're still alive today and in remission. So don't miss out on the opportunity to live a long and fruitful life. Cancer doesn't have to be the end if you're in front of it and ahead of it. Thank you.
Very powerful and a very sad message from Sean. And while you can, I want you to keep reading our key takeaways from this briefing and to help co-sponsor the HPV Act. I do want to ask some questions of our panelists if they could turn their mic and camera on. One in particular, which I have a partial answer to, but I want to actually reach out to Dr. Campbell, even though I know you're a pediatrician. And you noted that the vaccine can be given to those from ages 26 to 45 also, and why that why it would stop at age 45.
Yeah, a couple of reasons. One is most people who are going to get infected with HPV have already been infected prior to the age of 45. And as I mentioned in my talk, the vaccine does nothing for you if you've already been infected with that type. And there haven't been studies in older people. So without the studies to show that it's safe, effective, immunogenic, and knowing that the incidence is so low, people that of that age have not been targeted. That's not to say that off-label that couldn't be right for some individuals who maybe are going to have more exposure after age 45, but the recommendation for general vaccination is only up to age 45.
So I'm going to add something to that because I think there's some current research being done as to whether or not giving the vaccine after you've survived a cancer or surviving a cancer incident, it boosts your immunity towards HPV. But I would need to find the article that was published in New England Journal of Medicine or JAMA. But so it is cool what they might be able to use the vaccine after you're going through cancer. But I'm actually going to now flip it, going to a very touchy subject. So we are at age 9. Was there so not earlier, not a reason to go earlier even from age 9? I don't know age 9 is where the FDA approved, but there's a magic to that number not going to age 8 or 5. I think
It really goes back to the same issue, and that is there's really no incidence of HPV infection in kids under that age. And so all of the original studies were in teenagers and young adults, and then the second studies were 9 to 15-year-olds and compared to those older ones. So we only have studies of the vaccine down to age 9. We never license or recommend vaccines when they haven't had extensive study on safety, efficacy, et cetera. So we would need the studies to be able to do that. If you're vaccinating at ages 9, 10, 11, 12, you're capturing essentially everyone before what some people call sexual debut, where you may have any kind of sexual contact. And as was mentioned, it doesn't mean only sexual intercourse, really any contact. HPV lives on the skin and on the wet surfaces, so you don't actually need to have intercourse to get infected. So that's why we target that age, is to capture everybody before they ever could have been exposed, but not earlier than that, because we want protection for as long as possible. When it was first studied, we didn't know how long it would last, but now we know it lasts a very long time. So we have not needed to boost anybody. You get the protection for a very long time. It's amazing, these virus-like particles, just how long the protection lasts.
Which actually, you answered my next question. And I do want to point everybody into the chat that Crystal has found the article that I was mentioning that I had read sometime in the last few months that I thought was fantastic. And I wrote, I'm over time, but I haven't lost anybody yet. A quick question to the rest of the panels about the effectiveness of teenagers speaking or advocacy in your efforts in educating those that you are, meeting with, the youth, in essence, anybody, well, younger than me. Do you find that to be effective or just useful in combination with all your efforts? I sometimes think, and I've asked it, I guess I'm somewhat answering my own question, that sometimes when parents are talking and they also hear from others and teenagers are talking, there's just a better dialogue with everyone. In all fairness to everyone's time, I want to thank everyone for participating in the HPV Coalition's briefing today on preventing HPV-associated cancers, saving lives, and reducing healthcare costs. I would like to especially thank our speakers, Barbara Schuler, Dr. James Campbell, Dr. Sal Giorgianni, Dr. Bonhomme, and Crystal Rommen for their valuable presentations, and Sean Donnelly. I don't want to forget that, providing your information and about our ability to prevent all HPV-associated cancers and the challenges facing prevention efforts and the opportunities to save lives and dollars. I actually going to go back to Sean. I'm thank him really for sharing his personal journey, and want to wish him and his family all the best in the coming weeks. Our hearts are with you. And I hope that you all leave this briefing with a clear understanding of the HPV vaccination and its role in preventing cancer, saving lives, and reducing the need for costly cancer treatments, long-term medical care, and associated health expenditures. Thank you for being here and your commitment to learning and taking action. Thanks, everyone.